Well, May is Women's Health Month, and tonight our Lindsay Burrell is focusing on pregnancy care.
Lindsay spoke with local doctors about pregnancy risks and a nonprofit dedicated to caring for mothers and their babies.
According to Hopkins Medicine, approximately 8% of all pregnancies involve some sort of complication. And there are two main aspects of expecting women's health, one being the health of the mother and the other being the health of the baby. Dr. Monsager, a maternal and fetal medicine doctor at Mercy One, says that when looking at a mother's health, there are some notable trends as to why maternal mortality rates are climbing in the United States.
Bleeding around the time of delivery. Postpartum hemorrhage, and the other is hypertensive disorders, primarily preeclampsia.
And the risk factors surrounding these trends, like obesity and advanced age, are also rising.
So the bottom line is it's a combination of we as physicians and healthcare providers need to do better, but it's also we're dealing with a higher risk population.
Saying that it's harder to treat these issues while a woman is pregnant.
It's difficult to make major changes in your healthcare once you get pregnant. It's 9 months, not very much time to make a significant change in your own health care.
Suggesting that women who know they want to get pregnant take charge of their health beforehand.
We strongly encourage that women come in for a preconceptual consultation, if at all possible, if they know they have some of these comorbidities, so that we can try to address them and get them under as good a control as possible before they become pregnant.
And if unable, Mercy One works to ensure that patients are helped if a pregnancy-related complication occurs.
We have what's called an obstetric emergency department, which allows us to guarantee that every patient that comes into our triage area will be seen by a physician within 30 minutes.
But even if a mother isn't at risk for these complications during pregnancy, monitoring a baby's health at home is equally as important. And a local nonprofit organization is helping to empower women to do just that. Count the Kicks specializes in helping women understanding their baby's movement within the third trimester of pregnancy to help prevent stillbirths.
So there's so many risks in pregnancy. Stillbirth isn't talked about very much. And so oftentimes this happens and parents didn't even know it was a possibility that it could happen to them.
In Iowa, around 177 babies are lost each year due to a stillbirth alone.
Getting to know that baby's movement pattern and being familiar with it is really important. So if that were to change, then a mom can say, this isn't feeling right.
That's why Count the Kicks created an app that allows women to monitor and log the amount and the strength of their baby's kicks daily from the comfort of their home.
Research shows that a baby's movement is often the only sign or an early sign that the baby might be in distress.
Allowing expected parents the chance to inform their doctor if they start to notice any changes in their baby's movement.
So this is just a simple tool for them to use to help keep track of their baby's movements and to speak up.
A simple tool with a big impact, with over 110 babies saved nationwide and 40 here in Iowa.
With Count the Kicks, we play a small role in just a little tool that is so simple to use to help bring a baby here safely.
And overall help Iowa women have safe, healthy, and successful pregnancies.
You know, until you've walked in these women's shoes, you really don't understand.
We work to improve birth outcomes because we know we can make Iowa even a better place to deliver babies.
Lindsay has been focusing on the issues impacting women's health all month long. You can find her stories on women's health centers and the challenges facing women of color on our website, WHO13.com.